Auvergne 2023. In his little house just outside the village, Archibald, 75, is having a coffee as he does every morning, when suddenly he passes out. Seeing that he hasn't communicated at 10 as usual, Nestor, his domestic robot, warns the emergency department. SAMU team is immediately sent to Archibald's house, and his life is saved by dissolving the blood clot at the University Hospital in Clermont-Ferrand. In olden days, people used to say that there was a doctor in each constituency of France, but those days are over. Isolated areas, medical deserts. Soon kilometres will be less important than microbits. Being elderly with a chronic disease and living in the middle of nowhere without a doctor within reach and over 80 kilometres from the nearest hospital will no longer be a problem. If you're connected. For the health professionals, it's also a revolution. The HPST law has set up a legal framework for telemedicine, and priorities have been identified on national scale, such as the telestroke experiment deployed in several regions. The principle: 24 hours a day and 7 days a week, a neurologist and a radiologist are on call, ready to give their opinion to the emergency staff of the hospitals who need advice. This is what is known as tele-expertise. Remote surveillance to prevent emergency hospitalization is all just as promising. Jeanne, for example, is one of Dr. Tournesol's diabetic patients. Thanks to the medical devices in her home, her doctor can monitor the changes in her blood sugar levels and define a threshold. New uses to save more lives? Yes, of course, but not just that. By avoiding superfluous hospitalization and betting everything on the new technologies of the future, the promise is also an economic one, in all the senses of the term.